This is no ordinary hospital room. It's full of critical care staff and machines with their own distinct sounds, their own life-saving purpose.
How are you feeling today? You alright? How's your breathing?
Philip Wheatcroft is now oblivious to the ever-present bleeping inside the intensive care unit.
You stay positive, alright?
He's been here for 9 days. His health deteriorated quickly after testing positive for COVID-19.
If you get this, it really knocks you back. I'm usually fit and healthy. It's like me. Made me really fit. So you don't want to think it's not there, because it is.
Mr. Wheatcroft is one of 16 COVID patients at Chesterfield Royal Hospital's ICU. He's getting better, but he's worried what's around the corner.
What's the hardest thing about being in here?
It's not being able to see your family, and you don't know what they're going to do to you to try and make it right. It's a bit scary.
Elena Lee has been desperate to hold her mother's hand. It's the first time she's been able to see her since she was moved to intensive care. News of the COVID diagnosis came as a huge shock to the family.
It was just horrible when they confirmed it, because, like I was saying to the nurse, we didn't fit. We wasn't bothered about it that much. Like, we didn't think it was that serious, but until it happens to yourself, you realise the danger of it. So it is heartbreaking, it is.
Lena's mother has 37 grandchildren and great-grandchildren. They're all praying for her to get well and return home soon.
It just don't feel good because she's not here, is it? It just don't feel good at all. It'd just be a lot better if she was awake and talking to us. I haven't seen her like in a week now, and it's just nice just to see her, just to touch her. We need her to get better. We need her to get better.
As a matron on a respiratory ward, Vicky Turner is used to caring for patients. But during the first wave, she contracted COVID, needed care herself, and spent a week in hospital being looked after by her own colleagues.
It was very strange to be on the other end, but I know we're in good hands. Very heartwarming as well to see my team working and looking after me, and I was really proud. But yeah, very scary as well.
Patient numbers and the death toll continue to rise at the hospital. More than 300 people with the virus have died since March. Staff are busier now than ever before.
At the moment it feels like we're running on adrenaline because we're just trying to keep up with the work and to look after our patients. But there are moments when you're not at work or in periods of reflection when you realise just what we're going through, what our patients and our relatives are going through, and I think this will live long in our memory, I think.
Quite often the patients are on their own from a family point of view, but mostly the nurses are with them at all times, even when they do die. And it is sad, it's very sad. We've had such a lot of death, really.
Couldn't breathe before, struggling to breathe. It's a shock.
Raymond Shawcroft is 49. He isn't in intensive care but on a respiratory support ward. Mr. Shawcroft has diabetes and a number of heart problems. Contracting COVID-19 came as a bolt out of the blue.
I didn't think I was ill enough to be brought in, and to be taking somebody else's bed up that needs it more than me. You don't expect the extent of what this bug's got. It's not going away. You can't overlook it. So if it can do it to me, it can do it to other people, not just me.
Relatives of patients say they can't thank staff enough for all the help they've received.
They're just so good at the job, and people really do take them for granted because they are lovely people, and no matter what you need help with, questions answered, they're there and they do everything.
When you leave here, Phil, what are you looking forward to doing the most?
I want to see my missus. Let's go life back together, you know. Because with this, you don't know if you've got one, do you?
How do you think she's going to welcome you?
Oh, but no, ain't she?
A big hug
Oh, yes.
and a nice cup of tea.
Oh, yeah.
His recovery will take time. Mr. Wheatcroft describes the staff as heroes. He says they've given him a second chance at life.